So I'm here today to talk about something new that actually is a coordinated effort between all three public health departments, between Garfield, Eagle, and Pitkin counties. It's called the Care Coordination Network. And before I dive into it, I just want to provide a little bit of clarity around what I'm talking about when I talk about care coordination. So I would say probably within the last 5 years throughout the state and the country, there have been this movement towards implementing positions such as community health workers, promotoras, patient navigators, individuals that are out in the community doing a little bit more intense one-on-one, either hand-holding or counseling, or trying to get people to really implement their behavior changes as we've been talking about today. And that model's really been proven effective. So when I talk about care coordination, I'm talking about the spectrum of individuals that are doing the hand-holding. So this could be in the medical setting, someone like a patient navigator. It could be as simple as a resource navigator, a neighborhood navigator, someone that's just directing an individual to the resources in the community. So this whole process with the Care Coordination Network started about a year ago with a grant opportunity through the Colorado Department of Public Health and Environment, CDPHE. And so I wrote this grant to fund positions of community health workers over 3 years throughout the 3 counties, and it was really great, and it didn't get funded, so kind of left us flailing. And one of the big questions after writing the grant application was, how do you make this sustainable? How do you, through a situation such as a public health department, where you see the benefit of a care coordinator, a community health worker that's out in the community, reducing someone's ER visits, improving someone's health, that the public health department isn't seeing any money come out of this. There isn't really a sustainable funding model. So we kind of brought together a planning team around this idea of, yes, we love the idea of care coordination. No, we don't see any way that this is sustainable without grant funding. And we don't want to turn this into a system or a nonprofit where every couple years we have to apply for more grants, because that gets exhausting. So through this planning process of a lot of individuals that are sitting in the room today, we came up with this network saying that in our Tri-County area, Garfield, Eagle, and Pitkin, we have a lot of individuals that are doing this kind of work, that are in the community, that are trying to make people healthier, that are maybe don't fit your classic definitions of promotora or community health worker or patient navigator, but are really producing a lot of the same outcomes. So we thought it would be in our best interest, after several months of planning, to bring these individuals together. So I'm just trying to make sure I'm capturing all this. So as we all know, we have a very strong network of organizations throughout these 3 counties. We all like to work together, and we try to work together because we know individually we can't serve the wide needs of our population. So we're trying to pull out the individuals that are serving in the capacity of a care coordinator and bring them into one room to collaborate, to do some professional development and learn about resources. This proved to be a little bit more difficult. I mean, as I said, as Mitzi said, we just had our first meeting last week. So it's very much in the beginning stages of meeting and figuring out what are the needs of this population. And I think the difficult part that we've seen is, us as kind of higher ups in our organization, we're very familiar with meeting, and we meet a lot, and we talk about what we want to see done. But I think those individuals that are really the boots on the ground don't get together that much and don't have the opportunity to do that networking or figuring out who their counterparts in other organizations are. So really trying to drill down to those individuals to make this an opportunity that helps them do their job better, but doesn't take away from the great work that they're doing. I think in a lot of the research that's been done on community health workers and patient navigators, the successful efforts are when it's really driven by those individuals that are doing the work, not necessarily the director of the hospital that's saying, oh yeah, I think we'll really save a lot of money by implementing this. I think by tapping into the doers and the shakers, that's going to really prove to be sustainable. So that's kind of where we're at. I think we're continuing, or the hope is that this would be a quarterly meeting and a quarterly effort, and to start gaining information from these individuals is also a huge aspect to it. That as someone that wants to see more integration among community organizations, we also want to understand what the true needs of the community are, what the boots on the ground really are seeing. Which organizations are being overutilized, which organizations are being underutilized, which new organizations are funding. I think that's always something that as professionals we're struggling to understand and struggling to find out who's new, who's doing what, where's their overlap, how can we better make our services efficient and streamlined to serve people better. So so we had a lot of really great representation from Rocky Mountain Health Plans and Mountain Family and a lot of your employees. So it's been really great to see the turnout. I think it's just refining the process and getting individuals that really need to be there and getting people to see the value in doing this. So in the future, I think what we're looking towards is how to have measurable outcomes and how to really measure the impact that all of these individuals across organizations are having without dumping a huge database on them or figuring out what that database could look like. I think as a public health professional, I do want data. I want to know that this is working, but sometimes it's just trusting the process and know that this is a proven model. So yeah, working community-wide across organizations is really our goal, and to ensure that our population is getting served and is leading healthier lives. So I don't know, I'm trying to think if yeah, thank you.